Morning and welcome to the media briefing with the Windsor-Essex County Health Unit on Thursday, March the 10th. We are joined this morning by our CEO, Nicole Dupuis, and our acting medical officer of health, Dr. Shankar Nasathuri. We will begin our session with some opening statements from Nicole Dupuis, and then we'll move into our media questions. Thank you very much, Nicole. You can go ahead.
Good morning, everyone. Thank you for joining us. It has been 10 days since the Ministry of Health eased many public health restrictions related to COVID-19, including capacity limit. Yesterday, the province announced additional changes which will occur throughout the month of March. While these changes may be a welcome shift for many of our residents after 2 years of the pandemic, we want to acknowledge that it may be a stressful transition for many others. The risk of COVID-19 is still present in our community. We will continue to be monitoring the situation as we continue through the pandemic. Vaccination continues to be the priority and the cornerstone of preventing COVID-19 in our community. We encourage everyone to ensure they are up to date with COVID-19 vaccination. If you haven't yet been vaccinated or received your booster, we encourage you not to. It has never been easier to get your COVID-19 vaccine, as the mass vaccination site at Devonshire Mall is now taking all individuals on a walk-in basis. We want to remind all of our residents to continue checking for symptoms of COVID-19 and stay home if you are sick for any reason. Wash your hands regularly and continue to follow public health guidance and public health measures. Be aware of your personal risk level and that of your family, which may change how you approach the easing of these restrictions. If you live with or regularly visit someone who is more vulnerable to illness, take extra precautions before attending high-risk locations, large events, and traveling. We echo the message from Dr. Moore, Ontario's Chief Medical Officer of Health, regarding March break travel. If you are planning to travel, we encourage you to assess your level of risk as well as the level of risk in the location you will be visiting. Ensure you are up to date with your vaccines and follow public health guidance while you are away. And be sure to check the travel updates issued by the federal government. We have all lived through the same events over the last 2 years, but we'll have very different experiences. Many people have suffered significant losses as a result of this pandemic. Additionally, a large proportion of our community has been ill, some for very long lengths of time, and we've had long time periods of lockdown and an outbreak. Due to these varying personal situations, it's normal to have some hesitancy as the restrictions are eased. We encourage everyone in our community to practice kindness overall and understanding. The understanding that someone's outlook and approach may be different from your own. Remember, we do not know everything going on in someone else's life, so act with kindness and acceptance as we move through these times of transition. If you or someone you know has experienced mental health issues, visit our webpage at wechu.org/CV/mental health for local resources. Thank you.
Thank you very much. We will move into media questions, starting with CTV.
Good morning. Do you think March 21st is too soon to lift the mask mandates in most indoor settings?
Well, we defer to the province's assessment of the level of provincial-wide risk. At this point, the local health district is monitoring the burden of disease, and we're hopeful that there won't be resurgences of cases and additional burden of disease. The one thing we do know from the history of the pandemic is there are quiescent periods that are interspersed with periods of time when there's more disease activity, more hospitalizations, more deaths. And right now we're in a quiescent period, and I hope that we remain in a quiescent period. Nevertheless, we continue to monitor the effect of these relaxations based on the available epidemiological data, and then we'll make judgments and give guidance based on that assessment.
Are you concerned that residents will think the pandemic's over and disregard the remaining public health measures?
Well, the pandemic is not over. And I think that's the consensus of the public health community. I think that I'm hopeful that people will continue to follow the public health guidance Even though some of the guidance may no longer be required, there are many options for people to participate in public health measures. That includes wearing a mask indoors. That includes social distancing. That includes staying at home if you're sick. That includes washing your hands. It includes getting vaccinated and being up to date on your vaccination status. So I think that I expect that many people, perhaps most people, will follow public health direction, make choices based on their assessment of the risk. And I'm hopeful that the pandemic will remain in its quiescent phase.
Would you consider adding extra orders if necessary?
Well, the Public Health Service is governed by the Health Protection and Promotion Act. That statute, the legislature envisioned in that statute that local health districts and medical officers of health could effectuate public health orders if there was if that was required to address local challenges. At this point, I think that the health district will follow the effects of the latest group of relaxations. It's difficult to predict the future, and all the options remain open moving forward based on the local epidemiology and the local challenges. But one thing to think about is that Windsor-Essex has suffered disproportionately as it relates to the pandemic. In many metrics, it was in the burden of disease was at the higher end in Windsor-Essex. Schools had to close earlier in Windsor-Essex at a period of time during the pandemic. So the experience of the health district modulates the public health guidance and, on occasion, the public health direction that may be required.
Okay, thank you.
Any questions from CBC?
Not at this time. Thank you.
Any questions from AM 800?
Nicole, you mentioned March break, and obviously March break next week. Has the health unit been hearing from, I guess, residents, the community, just inquiring about travel and what they should be monitoring?
We always receive questions. I know, as I've noted before, where there are changes. I think right now it's a very confusing time. There's a lot of different messaging, and we know the federal guidelines are not always exactly the same as Ontario. So I think it was alluded to that, with the announcements of lifting additional restrictions and measures right before March break, people are, of course, asking questions about and have some unease and are asking questions about their travel. Usually, we will refer them to the various pages for the federal government. And again, as things are changing so rapidly, it's really important that individuals keep up to date and know the situation where they're traveling to, if they choose to travel, and ensure they can, travel in the most comfortable and safest way for themselves or their family.
I guess similar to what we're going to experience here on March 21st with the mask. If someone doesn't want to wear it, they don't have to wear it. But if they do, it's encouraged as well. I guess that's like that. If people's traveling in the States or elsewhere, so obviously if they go to a place that has those guidelines with the mask, basically what you said off the bat, everyone should respect everyone's decision if they choose to wear that mask.
Yeah, I would say that people have the right to assert their autonomy, and asserting their autonomy also includes the consideration of the health of other people. I think that it's perfectly appropriate that if one goes to a place where you can't maintain consistently 2 meters away from other people, that to wear a mask. Wearing a mask not only helps the person wearing the mask, but also prevents the spread of COVID to other people. So from my perspective, just because something is not required, it doesn't mean that one cannot do it, especially if it benefits other people in the community. I also think that it's important for employers to continue to have vaccine policies I think vaccine policies are an important cornerstone of trying to maintain control of the pandemic. We're in a quiescent phase right now, and I think we all want to remain in a quiescent phase. And so as we move forward with the pandemic, although requirements might have changed, people still have the option of using their discretion and acting in ways that can reduce the burden of disease on other people and other members of the community.
Thank you. I have one final question, but it's not COVID related. I'm not even sure if Nicole can answer this. It might be more of for the board chair. But just in regards to a permanent medical officer of health for our region, where do we stand with that search?
So we're still in the process, our board is still in the process of recruitment. So I don't have an update for you, but that we are still actively in that process.
Thank you.
We have time to take one follow-up question from our outlets. We will start with CTV.
When do you anticipate the health unit can wind down even more resources devoted to COVID? Or I guess how much has staff already been diverted to other areas?
So there's still, a considerable amount of our staff that are vaccinating. And so vaccination is still a really important priority. I have reported previously that we are slowly looking at bringing staff back to other program areas. Most of them have been redeployed, as I said, to vaccines. So we do have a short-term plan of bringing staff back. For the most part, our other big priority that we're shifting to, which we've already started, is the catch-up immunizations, obviously for children and youth. And so there's, quite a lot of work there. So right now we're sort of balancing staff between the two, and over the next few months, we'll have a plan to move individuals back into other priority areas to get those programs started.
Okay, thank you.
Yeah, if I could just supplement that, there are, as important as COVID-19 vaccination is to controlling the burden of disease, there are other vaccines that are also immensely important. The HPV vaccine is one of the most effective strategies to control cervical cancer. And we have an organized program in this province to get people vaccinated, young people vaccinated. And I think that we can give you the exact number, but I think there are like approximately 10,000 young people whose vaccines are not up to date beyond COVID vaccination. And so that's an important priority. Meningococcal vaccine is also important, especially when young people are going off to college dormitories and university dormitories. And that too is something we have to bring young people up to date on. The services for newborn children, newborn infants and mothers, that's a gap that we need to address. It's an important public health direction, and we need to get back to that part of our service model. We had 2,500 people die of opioid deaths in the province. That's perhaps four times as many people who die in car crashes every year. And that too is a priority that we need to address. So I think it's a bit premature to wind down all of our COVID-related activities because I think the pandemic continues. However, I think that as we have more capacity, we have to shift back to those other public health priorities, which perhaps have been not as well addressed as we could have because of the resource issues.
Thank you.
Follow-up question from CBC.
Yes. So with the lifting of these restrictions by the province, it's now going to be up to businesses and individuals to govern, how they choose to protect themselves. You kind of alluded to that before, but I guess what's the role of public health now as people try to navigate how they are going to self-govern?
Well, the Public Health Service historically has worked towards having dialogue and education and guidance. It's only in the most unusual circumstances that we have to effectuate public health orders and direction. So engaging in dialogue is core to the foundation of public health practice, and that's what we'll continue to do. The second point I would perhaps share is from my perspective. When one institutes policies at an organization or an employer, not only are they assisting in minimizing the burden of disease to their workforce or their patrons, they're also effectuating or reducing the burden of illness to other members of the community. And that too is an important goal, and I anticipate that employers, public and private, operators of enterprises, will consider that as they formulate their policies for their respective organizations.
Thank you.
And a follow-up question from AM 800.
I guess, Doctor, going off my last question to Nicole, you've been doing the acting role for about half a year now here in Windsor-Essex. Just want to get your thoughts on how you think the last year and a half went, and are you interested in a full-time role here in Windsor-Essex?
I wasn't expecting that question, so I think that for now, the acting role is what I think would be my preference. I think that thinking back to the pandemic, if I could share, pandemic has been unpredictable and it's been disruptive for every person in the community. I do think that Windsor-Essex has a very professionally run public health service. And I think that the 300 people at the health service have been doing a spectacular job at trying to advance the health of the community. And I think they should be recognized for their commitment from the beginning of the pandemic up till this point. So that would be my general observations of the pandemic.
Thank you.
Thank you all for joining us. That concludes our session for today. We'll reconvene. Our next scheduled session is Thursday, March the 17th. Thank you very much and have a great day.
All the best.